The two different approaches for a hip is either an anterior approach or a posterior approach, and the precautions will change depending on which approach you have. If you have any questions upon which approach that is being performed, make sure to ask your surgeon. The first one we'll cover is the anterior approach. The anterior approach precautions are that you are not to extend the hip past neutral or to adduct or cross midline across your body past neutral. The most common way that people make a mistake is while they're walking with their surgical leg. If this was my right hip that was replaced, you are not allowed to extend past neutral. So I would not want to take a step back with my surgical leg. To correct for that, when having to step backward, step back with your non-surgical leg, step together, and repeat the process with your non-surgical leg until you are done. The posterior approach has limitations of no hip flexion past 90 degrees. You are unable to externally rotate the hip past neutral, and as well with the anterior hip, you cannot adduct the hip past neutral or the midline. Common ways that people tend to break their posterior hip precautions typically are related to seated positions. You are unable to flex your hip past 90 degrees, or when in a seated position, your hip and torso can't break a 90-degree angle. So if the chair is too low that you are sitting in, a common way to correct this is to find a pillow or a bolster that can be placed on the chair to raise that up. Then when you are sitting in the chair, that angle of your hip and torso does not break 90 degrees. Another seated activity to be aware of is when sitting, you are unable to externally rotate your hip, and to get shoes and socks on, we cannot allow this position to occur as it breaks usually both the flexion and external rotation precaution. Another activity that will break precautions for both the anterior and posterior approach to be aware of is when it is tolerated that you are lying on your side. We want to make sure that there is a pillow between your legs so that the hips stay neutral and you do not cross the midline with your surgical leg, breaking the midline precaution.